So we're here with Deanne. Thank you for being here. And we're going to talk about what you've gone through. You had some arm pain. You've had it in the past. You had it treated. I think it didn't completely go away, or at the very least it came back recently. You tried to have it treated again. It wasn't going away, and then you found me. So can you talk a little bit about what you've been through?
Yeah, so back in 2010, I had a spinal fusion, and it was because I had scoliosis.
And you had probably the biggest fusion I think I've ever seen in my career. It was T2 to L5, correct?
Yes, correct.
So that's a long fusion.
Yeah, it's pretty long. So I had that surgery back in 2010, and I was doing well, and then in 2018, I had an accident. Not really sure what happened, but I had a couple disc protrusions and herniations in my neck above where my fusion was.
And what symptoms were you having?
I was in a lot of pain. I couldn't move, so the whole left side of my body was like numb and sharp pains.
Like down into your arm?
Down into my arm, all the way into my fingers. So it was just very painful to walk, to sit, to lay down, to do anything.
And so you went to the doctor, and did they immediately look at your neck?
No. So whenever that happened, I didn't know what was going on with my body because I never experienced that. So I went to the ER, and I said, I explained to them my symptoms, and I was like, I actually think I hurt like a nerve in my neck because I've never felt this before. And they said, I think you just pulled a muscle, but I had pulled a muscle lots of times.
Well, and that's why I'm so glad that you're here telling this story, because this is going to resonate with so many people. Like if you have, I say this all the time, if you have numbness and tingling, it can't be a muscle issue. It has to be a nerve issue. There has to be a nerve involvement, but you know, it gets overlooked, I would say 9 times out of 10, if not more.
Yeah.
So the ER person said that it's a pulled muscle. What'd they do for you?
So they just gave me a muscle relaxer.
And obviously that didn't help.
It didn't help. So I went to my primary doctor, and I received no help. They did not give me a script of any kind.
What did they say was wrong?
They just said it was a muscle issue, and that it would.
And we talk about this on this show too. Once one doctor says something, they basically treat what the previous person diagnosed. And the horrible thing for this is that you literally said, and not many people will, like, I feel like it's a nerve issue in my neck. I mean, you literally said what was going on. But, all right, so the primary said it was a muscle issue again. Did they give you any medication?
No, I couldn't even walk into the office. My mom actually almost had to like lift me in because I was in so much pain, but they didn't give me a script for anything, or even to see, to get an MRI done, which is what I needed to know what was really going on. Yeah. And
so how'd you eventually get?
So I eventually found a chiropractor because I just wanted to get some sort of relief. He wouldn't touch me because I was in such bad condition. So then I ended up going to pain management, and I had to go through all their steps and stuff. And whenever I went to pain management, then I found a physical therapist, and the physical therapist started helping me. So at that point, when I started to see the physical therapist, I was able to get some movement back, but it was so extreme. How long from the time you went to the ER to the time you got to the physical therapist, how long was that? About a month and a half.
So a month and a half of, sounds like pretty significant pain.
Yeah.
Right? And again, glad you're telling this story, because you went to the ER, you went to your primary, no help, you went to a chiropractor. The chiropractor was basically saying you need to get your pain down first, sent you to pain management. Did they do anything for you? Any injections or medications?
So I was finally able to receive an injection, but it was about 2 months after the actual incident.
Pain management gave you pain management, which I know it sounds redundant, but when I like saying that, because it literally is just managing your symptoms. It's not treating the underlying cause, and people need to understand that. So, and then you went to physical therapy. So 5 people that you saw throughout this month and a half, 2 months time, and it shouldn't be that way. It shouldn't, and we'll get to kind of what you went through with me, but so you went to physical therapy. Physical therapy, it sounds like it was helpful. Did it help right away, or did it take some time?
It definitely took some time just because it was so severe.
How long do you think?
I ended up doing physical therapy for about 6 months.
Wow.
Yeah.
Wow.
Doing that. Yeah.
6 months. And again, not uncommon.
Yeah.
And was it 2-3 times a week?
About, yeah. So before I received the shot, I was going 3 times a week.
Okay.
And then whenever I got the shot, then I was going about 1 to 2 times a week.
So let's say 2 times a week for 6 months. You're looking at about 48, 50 visits, somewhere around there. So 50 visits is the same physical therapy place? Or?
It was the same physical therapy place. And as I was there for a while and I had received my shot, I was still getting some of the symptoms coming down my arm, the numbness and the tingling, the weakness. And so my physical therapist was saying, well, we might need to consider a second shot to do that. And so just to manage my symptoms and make sure it doesn't get worse. And so my goal was to not get the second shot. So I was just trying to be really diligent in doing exercises and minimizing things that I would do that would potentially have it slip again.
Which is good, but in another sense, it's you saying not really living your life. Like your symptoms were taking control of or taking over what you could or couldn't do.
Yeah.
If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
So after those 6 months, were you pain-free then?
I was not pain-free. I was basically just trying to manage. And so I had found a massage therapist and I was going to him about twice a month to just kind of make myself feel better. I did have my uncle, who's an acupuncturist from China. He came one winter and he did continual treatments on me. And that was the first time that I was actually pain-free whenever I did acupuncture.
When was that?
That was the winter of 2019.
Okay.
So I was pain-free for about 2 months after he was really consistent working with me.
But again, massage therapists, acupuncture, physical therapists, pain management, family physician, ER, I mean, like 6 different people that you're seeing, and it sounds like at this point, it took about 8 months worth of treatment to get pain-free.
Yeah.
That's a lot. Yeah, it's a lot. And I mean, 8 months being in pain, seeking treatment, paying for treatment, going to visits, not understanding what maybe the root cause is, what's going on, thinking maybe you might never be better, right? I mean, after a few months of not feeling well, you start to think, hey, is this going to be me? You know, is this going to be for the rest of my life? Were you ever considering surgery?
Surgery was the last option for me just because I had went through my spinal fusion and I knew what it took to recover from that, and I had heard too many stories of people getting surgeries in their neck and just the downsides of that happening, and I already knew I just didn't want to go to that direction of going for a surgery.
And it should be the last result, right?
Yeah.
I mean, it shouldn't be first, second, third. It should be the absolute last. We can't do anything else. There's no other treatment. So, all right, about 8 months worth of time, 6 or 7 different people, finally pain-free, but it sounds like the symptoms eventually came back.
Yeah. So I got pregnant and I had my daughter this year, and in November, beginning of November, I woke up in the middle of the night and my disc had slipped.
How'd you know?
I woke up in excruciating pain.
Where
I
at?
couldn't move. In my neck, down into my arm. So it was the same symptoms that I had felt whenever this happened back in 2018. And I was in a lot of pain. I couldn't move. I couldn't do anything.
And what'd you do for it?
I just started remembering everything that I did for physical therapy and the stretches and the like the moving your neck to kind of like relieve things. And so I had my husband try to help me, but nothing was working. And finally I just I put a towel behind my back to push on my disc to get some sort of relief whenever I was laying down.
And I think eventually you went back to the doctor.
I did.
And then you went back to physical therapy.
Yeah.
And this was a different physical therapist.
This was a different physical
Why'd you go to a different one?
Because of insurance.
Okay.
Yeah, because of insurance. And so I went to the physical therapist, and because I had my daughter and I was nursing, I didn't want to take the steroid shot again because it would affect those things. So I was going to the physical therapist, and I was doing the same exercises that
as the last one?
As the last one.
Okay.
So there was nothing new under the sun.
Was it helping?
They had me doing. It was helping to an extent, but I was still getting the numbness and the tingling coming down. I had really sharp pain going down into the middle of my arm. And I wasn't able to hold my daughter for about a month.
Were they just treating your neck, or were they treating your arm as well?
They were treating my arm as well. I felt like whenever I was doing those exercises, it was not targeted in the neck, and it was more.
I think I remember you were doing some
areas.
like forearm and bicep strengthening, right?
Yes.
You were doing like bicep curls and
Yes.
some gripping exercises.
Yeah, a lot of nerve tensions and nerve glide exercises.
All stuff I don't do.
Yeah.
So and I think you saw that physical therapist for about a month.
Yes.
Okay.
Yeah.
It
and
wasn't
it was like 3 times a week.
3 times a week for a month, so let's say 12 visits. Wasn't working, and then how'd you find me?
Through a good mutual friend of the both of ours. So she had seen you, and she had really positive results, and so she just spoke very highly of you.
So we had our first visit, and what was the difference between what we did, what I looked at, versus some of the other people that saw you?
I would say the biggest difference right away was probably your approach to how you took care of what I was saying, and so immediately you like targeted the neck with those exercises and what you had me do. And the first exercise that I didn't have like my other physical therapists. I had never done that before.
Did you do anything here with me that you've done before?
No, it was all new. Yeah, all new stuff. And so that first exercise that I did, it was the first time since that injury had happened back in November where I could like feel blood like coming down my arm, and it felt warm. I felt like I could move it.
And it's basically you feeling the nerve starting to, we'll say, recover.
Yeah.
So there was pressure on the nerve since November.
Yeah, since November. And probably even before that, it was just trying to hold itself, and then it just
Now,
let go.
we only did 3 visits together.
Yeah.
How long did it take for you to see progress?
I would say within the first week of doing the exercises, I definitely was feeling way less symptoms, and so that was really encouraging. But then by the second week, I just started to feel a lot better, where I wasn't getting as many symptoms down the arm. I was feeling stronger. I still didn't have the stamina that I wanted because doing simple tasks was taking a lot out of me, but I wasn't getting the tingling, the numbness, the pain coming down my arm after those 2 weeks.
Nice. So 2 weeks, and after the first visit, and we only did once a week.
Yeah.
So after the first visit, it was a week later you came back, you said you were about 70-75% better, and mainly for pain.
Yeah.
Your big issue was now the stamina, which that takes a little bit more time too. We built off of what we were doing. I gave you, I think it's 4 exercises total.
Yeah.
Is that correct? So
Yes.
4 movements total. How are you doing now?
So now I haven't had any symptoms at all coming down my neck after that second visit. And after the third visit, my stamina has increased exponentially, where been able to lift my daughter and carry her and do dishes and vacuum, all those things I didn't
all
do
the fun
before.
housework.
Yeah, all the fun house stuff that you do whenever you're a mom and a wife. So, but yeah, I wasn't able to really do that. I was trying to be really cautious because I was scared it would happen. My neck would just give out again. But now I'm feeling a lot better, that I feel like I can keep up with my daughter and do what I need to.
Nice, and that's a big difference, right? Yeah. I have 2 young kids, and when you're not feeling well, you're sick or you're injured, it really dampens your life and with the kids, right? Like sitting and playing on the floor or wrestling or playing a game, and that just in your head you think about how it's going to make you feel versus just being there with the kids. So I'm really glad to hear that.
Yeah.
So we talk about kind of the other stuff that you went through, the acupuncture, assuming that you said massage, stretching, nerve gliding. There's other treatments like, Graston and ultrasound and taping. Did you do anything else like that? Any other type of?
Well, people who were taking care of me were being very cautious because of my spinal fusion. And so they were very hesitant to do, I think, more extreme things with my neck just because of my fusion level. So I hadn't done those other things.
Well, were we cautious?
I feel like you felt confident about what the issue was, and because you know your stuff, and whenever you're working on it, like, it just worked. And so I think it wasn't about being cautious, it was about being confident about what the issue was and knowing how to manage it.
Yeah, and kind of getting what I was driving at a little bit is we didn't do any of the pain management stuff.
Right.
We didn't massage, we didn't stretch, we didn't put a hot pack or a cold pack. And I know acupuncture has helped, and again, I'm not against any of these, but most of it is really just pain management. No injections, no pills, no stuff that just makes you feel better. We did stuff that is supposed to address the underlying problem. And that's the whole point of this philosophy. That's the whole point of my treatment is that, and again, I've done all this in my career. So, I'm saying don't do this, and there's going to be a lot of people out there that are all upset. I've done nerve gliding that I said don't do. I've done those stretches that I said don't do. I've done everything to my patients throughout my career. But because I saw it just not work that well or work in a limited way, limited fashion, I just kept looking for something better. And, correct me if I'm wrong, but we didn't do anything amazing here. We didn't do anything like...
Yeah, it wasn't like earth-shattering.
Right, you're not standing on your head. There's no equipment here whatsoever, basically. We just, for me, it just makes so much sense. We just targeted the problem, and we didn't do any of the fluff.
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
So, but I'm so glad that it helped. But I'm frustrated because it took us 3 sessions over the course of 3 weeks. You were suffering since November, so I think you had your recent symptoms for about a month and a half before you saw me, something like that. And your previous symptoms, 8 months for relief, 6 or 7 different practitioners, clinicians that you're seeing, and that's the norm. And it doesn't have to be, and that's the frustrating part, and that's the message that I'm trying to get out here, that if you target what's actually the underlying cause, like again, like not to throw shade on your PT, but doing forearm and bicep strengthening is honestly, it's just crap treatment. It's just
and doing the putty.
Yeah, so if you're out there and you're doing, unless you had like a hand fracture, if you're out there and you're doing some putty and the digi-grip and you're doing some like the web expander and stuff like that, if you're doing you're picking up beads, did you do any of that stuff?
Yeah.
Oh no, like picking up marbles?
The first one I did.
So if you're, and again, unless you had like a stroke or a hand fracture, you shouldn't be doing that. But it's the norm. It's the absolute norm. The norm is injections. The norm is medication. The norm is telling you that it's a muscle strain and you'll get better. The norm is trying to strengthen the areas that are weak, but it's not those areas that are the problem. There's an underlying cause. And for you, the frustrating thing is that you said you had pain, numbness, and tingling running down into these two fingers. C5, C6, that's not that hard. That's so, and why I was so confident and why I wasn't really too worried about your previous fusion is that this area isn't innervated by anything for your previous fusion. So everything made sense that it was coming from your neck. And at the very least, we had to address that first to see if that was the problem.
Yeah. And I think one thing that was deterring me away from other PTs was their first line of defense was you need to take the steroid pack and you need to do the shot. And for them, that was their first line of priority before really thinking about how to care for what that actual issue was. And so I always encouraged whenever I came that there was a good alternative solution to those other things, where I walked out feeling like, okay, I think we have a game plan and we know what to do.
Well, and maybe talk about that a little bit, because a trust factor is a big issue, right? And I don't take insurance, so it's more expensive. How do you get over that barrier of, you know, I could go see somebody else, I could go get medication and maybe feel better right away. How were you looking at it differently? Why did it make sense to see me?
So I had spent a lot of money from beforehand, and so I came to a point, both my husband and I were talking about it, that even though it might cost a good amount, we needed to invest in my health so that I could be able to do the things that I needed to do to be able to work, keep up with my daughter. And so even though it was a sacrifice to be able to do it, it was one that we knew that we had to take for the long term, because after coming, I knew that the exercises that you were giving me and the strength training, all those kind of things, that I could continue doing them after our initial visits were done, you know? And so the knowledge set of what you gave me, I could continue it and know that I could manage it, you know? Because there were certain things you told me that I didn't know before about.
Like what?
When the disc like, you were talking about the balloon, right? Like whenever it slips, then how there's pressure and it's a balloon and it's just like pushing it back, where I didn't really know that, because how it was explained to me before was, since I had a disc protrusion, the way it was understood was the gel in the disc is being slipped out. And so I'm just thinking like, everything's seeping out and like my disc is deteriorating. But so that was scaring me, you know, so knowing a different perspective, or the perspective that I just didn't know about, that it can be brought back into alignment and it can be taken care of, was encouraging to me. That I was like, well, if this does happen again, hopefully it doesn't, then I know what I need to do to bring it back.
Well, and again, everything you're saying is so good because it's so common. You get the fear of God put into you after you have an image. You get told that you have a herniated disc. You get told that you have spinal stenosis. You get told that you have all these problems, and you're like, well, what do I do about it? I don't want to be crippled. I don't want to. You get to the point where you're like, I don't want to move. You know, I'm afraid of making this worse, and you don't understand that. Actually, a lot of these are normal. A lot of these are normal findings, and a lot of these are very, very treatable with just the right movement, you know? So, and again, it's very frustrating on my end because I see this all the time. I see people like you that have very clear, in my opinion, very easy to treat symptoms, and they go down this rabbit hole of ER and primary and PT and chiropractor and pain management, massage, and other avenues of just trying to manage their symptoms, and they're not doing anything for the root cause. They're scared, they're in pain, they're spending their money, their time, and it just doesn't have to be. And I see a different medical system if we can kind of just stop doing some of the stuff that makes you feel good and start doing the stuff that actually makes you stay better.
Yeah.
And I feel like it's a simple and easy approach, and I don't know, what do you think?
Yeah, no, I mean, I completely agree, because after my first neck injury that happened in 2018, it was just really infuriating because I had to defend and fight for myself, like not getting a script for anything, and it took forever to get answers. And then once I got answers, it was an even longer process to actually get treatment. And then even that treatment I knew was going to just be temporary. It was putting a Band-Aid on my neck. And so from that time of 2018 to now, I was just trying to hold myself together so that I could function. And so whenever it did happen again, it was frustrating, but everything in me was like, I can't have this happen again, because it takes such a huge toll on not just you individually, but your family unit, your job, just your general lifestyle. So.
And something that we don't really get into, kind of your mental well-being too. You start getting, I don't want to put words in your mouth, but you start getting depressed. You start getting the life is taken out of you a little bit for chronic pain, for chronic long-term pain. And honestly, like if you're in pain for more than a month, you're starting to think you start to become these symptoms. This is your new normal. And that's frustrating.
Yeah. I mean, I am a go-getter, and most people that know me, I'm constantly filling up my day. So whenever this happened, it did slow me down a lot, but I couldn't let that control me, especially being a mom. And my biggest thing was I just need to keep up with my daughter. Like, she's a big girl. I need to be able to hold her, be there for her. There's a lot of bending and carrying and lifting that happens, and I wasn't able to nurse her for a while. So there were just all these things that were like accumulating. So it does affect your mental state, your physical state, your spiritual state. There's a lot that goes with it.
And this most recent symptoms came on after you delivered and you were nursing and caring for your daughter.
Yeah.
This is super, super common, and it almost always gets diagnosed. You know what it gets diagnosed as?
What?
Carpal tunnel.
Oh.
A lot of people, anybody ever tell you have carpal tunnel?
I did have one person consider it would be that, but after I had explained my whole story, and they didn't think it was. But yeah, I have heard that.
It almost always gets diagnosed as carpal tunnel in new moms, or young moms, or moms of young children, however you want to phrase it.
Yeah.
So great, thank you for being here. Thank you for sharing your story. Maybe the final thing is, how do we fix this? How do we stop this from happening in the future? Not for you, for other people. Yeah. What's the solution? Because I honestly don't know.
Yeah.
I'm trying. I'm trying with the podcast and on TikTok. I'm coming out with some course series and stuff like that. But how do we change this? How do we make this the norm?
Yeah. Yeah. I think it's a very, it's easier said than done, obviously, right, of what it is, because it's the bigger system at large of our healthcare and how it needs to be treated. But a long time ago, I wanted to be a nurse, and I decided actually not to be a nurse because I saw a lot of corruption in the system. And all that being said is, I don't think people view your body as a whole, and your body does need to be seen more holistically and to view all the issues that could be happening. And so whenever I was going to the PT and all those kind of things, and to the doctor even in general, I don't think they view your body in a holistic sense.
No, I agree.
And I think it is a viewpoint that people have to work on changing their perspective of how to care for their body as a whole. And it's just doing what you're doing, of doing your podcast and those kind of things, and trying to educate people, and more knowledge, the better.
And let me put it this way. So this is 2025. I'd say about 9 years ago, I'd say I was a good PT. I had a few certifications, but I still had that same normal mindset. I would have done everything that you said. And if you had told me at the time, if somebody came in with shoulder pain or elbow pain or wrist pain, and you had told me that, hey, it's their neck, I wouldn't have understood what you were saying, and I would have kind of laughed at you. And now, 9 years later, I'm the guy that says, like, if you're having some undiagnosed or untreatable asthma or Crohn's or, you know, not even just like joint pain. I'm saying like, hey, it might be your spine. So it took me 9 years to get to that place.
Yeah.
And I kind of fought it along the way because it's frustrating. It's frustrating to see something in a different way than most people see it. And because you sound a little, I don't know, a little crazy.
Yeah.
You sound a little crazy.
Yeah,
You sound a little
for sure.
myopic in your focus. But it's like the opposite. It's like saying, hey, it might not just be your arm. It might actually be your spine. So it is considering your body as a whole. So it took me 9 years to get there. I don't expect other people to get there quickly, but it's frustrating.
Yeah, I think just keep pushing forward and keep doing what you know, and sharing that.
Well, thank you for sharing your story. Again, it really resonates with me and what I've seen. And I hope, and I'm sure it will resonate with people that see this, that have had neck pain, arm pain, you know, pain, numbness, tingling running down their arm. You had basically the exact same care that almost everybody gets. I'm glad that we crossed paths, and I'm glad it was helpful. And thank you for trying to get this message out.
Yeah, thank you. I really appreciate it.
Yeah.